Hello, my name is Chrissy Reichert. I am a student in the Doctorate in Athletic Training program at Indiana State University, and today I'm going to be talking to you about the disablement model and injury prevention. Now, to aid in understanding of this concept, I'm going to be using an acute groin strain throughout the presentation. So first, we're going to go through the disablement model, talk about injury risk factors, and end with injury prevention. So first, the disablement model. What is the disablement model? A disablement model is essentially a very powerful organizing tool that helps to emphasize the whole person by taking into consideration it helps to address patients' health-related quality of life because, as we all know, an injury, is so much more than the physical. So it begins with, well, first way we're going to start is there's 5 domains to the disablement model. Now here there's only 4 listed, but I will be describing that so there's no confusion. It begins with the origin, so a pathology or the condition at the cellular level, and then it goes to an organ, an impairment of a body structure. It's not functioning correctly. Third is a person, and here is listed as functional limitations because that's exactly what we're measuring. And 4, here is listed disability, which includes both societal and environmental factors. So how does the disability affect your social and environmental life? And we're going to be taking a look at that as well. So to aid in some understanding, here's an example. So first we have our active pathology at the cellular level, which is a groin strain. We then move on to impairment, and you have that decreased strength because of the strain. We move on to how it affects you functionally, inability or decreased ability to cut, sprint, kick, punt, or jump, depending on your sport. And finally, how it causes disability or societal and environmental. So it's the inability to fulfill the role as a starter, an athlete, or in a sport-dependent position. Next, we're moving on to injury risk factors. Now, there's several categories here that can be used to describe the different, well, categories. Intrinsic is within the body. Extrinsic factors are outside of the body. Modifiable are those that can be changed with intervention, and those include both, all environmental, anatomical, neuromuscular, and hormonal. So environmental here would be like playing surface or footwear. Anatomical could be your body composition. Neuromuscular could be your strength or your muscle stiffness, and hormonal could be things that aren't easily or can be treated with proper medications. And then you have non-modifiable, so these are important identifying at-risk individuals and not necessarily for prevention. Environmental here is something like the playing situation or how your opponent is behaving, your cue angle or your postural alignment. Hormonal could be something like your menstrual cycle. And finally, demographic, age, sex, height, race, those types of things that can't be controlled. It's a keynote here that some modifiable factors, such as, say, a playing surface, are not feasible to change, whereas some non-modifiable, such as a groove, your patellar groove, can be altered with surgery. So it can help eliminate those. So you have to keep that in mind. Next, we move on to injury prevention. We'll be focusing primarily on the mu-wise model. So the mu-wise model takes into consideration 5 different areas. First, you have to have an internal risk factor. So things I mentioned earlier, age, gender, anatomy, limb dominance, things that are specific to a sport or position. Existence of an internal risk factor, so somebody has to have it. An external risk factor, so level of competition, shoe, playing surface, things that can occur on the outside of the sport or the injury. And you have to have a susceptible athlete, although an injury could be more prevalent on turf. If you're not playing on turf and you get that injury, there's not necessarily a correlation there. And finally, there has to be an inciting event, so something that causes that injury. So it's a training program or a particular movement or a game situation, and then you get the injury. For example, the acute groin strain. An intrinsic risk factor would be ratio of the hip adductors and abductors, or decreased range of motion of hip abduction. An extrinsic factor could be level of competition or sport. So for instance, a soccer player might be more exposed to this injury than that of a swimmer. Occurs. To be able to prevent this injury and to identify the risk factors, you have to take into all considerations of an injury. For your general knowledge, there is not currently a gold standard for preventing an acute groin strain. So how does all this relate to athletic training, and why or how does it relate to health-related quality of life? Health is defined as the physical, psychological, and social domains of health, seen as distinct areas that are influenced by a person's experiences, beliefs, expectations, and perceptions. Now, if you notice in this definition, you don't just see physical, you see psychological, you see social. And if you see in model, it takes into consideration the societal and the hormonal and the risk factors and the physical as well. So be able to truly treat a patient, the model it really does help to explain why two people with the exact same anatomical injury do not recover in the same amount of time. If you look at the history of athletic training research, we're very disease-oriented research. Right now, our profession is moving. We need to make more patient-related outcome measures. We need to find out why our patients are doing something or how this affects our patients. Our profession is growing. It's going towards the direction of healthcare provider even more. Right now, we're not really seen as high as PTs or doctors. But if you look at their professions, they are using patient-rated outcome measures, and the disablement model is the framework for that. So if we start with a disablement model, we're able to advance our profession as it grows. As I mentioned earlier, there's also more to an injury beyond the physical. You have to take into the psychological, you have to take into consideration the societal to really be able to treat the injury. And finally, it all comes down to our patient. We need to optimize patient-centered care. If we can prevent or if we can identify risk factors, then we are able to give the best patient-centered care that we can and to hopefully prevent the injury to begin with. Thanks everyone for listening. If you have any questions, please reach out. And I hope this really aided in everyone's understanding.